The topic I will be discussing today is MDMA-assisted psychotherapy. This topic is important because the current data reveals that when used in the appropriate setting, MDMA-guided psychotherapy for PTSD has a higher safety profile than the current treatment guidelines of SSRIs and psychotherapy. This has the potential to reshape how we view and treat other mental health disorders, as similar approved treatments have been used in the management of depression with intranasal ketamine. The bioethical dilemma in this current event is the scheduling of MDMA as a Schedule 1 narcotic, indicating that the drug has no medical benefit with a high risk for abuse. Beneficence is the bioethical principle of acting on behalf of the patient by defending their rights and preventing harm. This principle is violated in this current event because several studies have shown the efficacy with little to no harm when compared to traditional treatments. More research is needed to determine if this treatment is substantially more beneficial compared to traditional therapy. However, this modality does require significantly fewer doses, with effects lasting longer, upwards of 1 year following sessions, with little to no long-term consequences having been identified. Relevant nursing provisions for this current event include provisions 1, 3, 4, 5, 7, and 8. These provisions are centered around patient safety, rights, quality of care, and access to evidence-based treatment. Each of these provisions are violated when the patient has treatment-resistant PTSD and cannot access this novel modality due to the DEA refusal to reschedule MDMA from a Level 1 designation. This is important to the nursing profession because as nurses, we are called to protect the safety and welfare of our patients and enhance care when possible. The denial of this treatment to patients who need it due to failure of current available treatments serves as a call to action to advocate for the rescheduling of MDMA. The potential advocacy issues may involve garnering enough attention while also educating the public about the drug's benefits. MDMA unfortunately has a stigma attached to it being an illicit party drug. Recommendations for advocating for this treatment would include further research to support its use and education regarding the safety of this drug when developed and used in a safe, controlled environment. Some discussion questions to consider to help guide this discussion are: nursing and medicine are always advancing. How comfortable are you with keeping up with evidence and adapting your practice? And have you ever had to advocate for your patient knowing that they weren't offered the most optimal treatment? How did you navigate that situation, and what was the result?